Dr. Aronowitz, there is a lots of discussion out there about, people having headaches, shoulder pain, neck pain, even lower back pain, and all that because they have a malocclusion in their mouth. Basically, their teeth are not aligned correctly. That may come from an accident. It may come because they are badly grown in the first place, or whatever it may be. Grinding their teeth, all kinds of things. And it's called TMJ. Basically, the joints here, it's just one way or the other way because of the misalignment. Now, being a mechanical machinery engineer, I can think with cogwheels not being straight in it or missing because it creates havoc. And it creates havoc not only where the cogwheel is there, the whole thing doesn't work, like a Swiss watch. Try to cut off one of those little teeth in a cogwheel and it will not be a Swiss watch anymore. It will be giving you the time based on the weather or so. So does an orthodontist have any influence of correcting this misalignment in the mouth, and by doing so getting rid of sometimes severe headaches, migraines, neck pain, shoulder pain, and basically a very uncomfortable life?
Well, of course, Helmut, we are all connected. All parts of our body are connected, and when one system is not working properly, it can often have an effect on another system. It is somewhat similar to the mechanical example that you gave, but that mechanical example changes a little bit when it comes to the human, because people are constantly repairing and healing themselves. So that a young person might have a problem with their knees or their shoulder or their jaw joints, as you mentioned, but because they're young and because everything is healing itself, it never really affects them until such point where the damage that's being done exceeds the body's capacity to heal, and then things start to break down. And if it's the jaw joint, which is what orthodontists are concerned about, that can be caused by inefficient teeth that aren't chewing properly. It takes more force or more chewing strokes to chew the same amount of food, and the joint wears out or the muscles become spasmed, and that can affect other parts of the body as well. So we are very much concerned about getting the machine, if you will, of the chewing mechanism working as efficiently as can be.
Okay, so my question, I'm not so sure I personally got an answer. Maybe you did, I just didn't get it. So when people have, so first of all, do orthodontists help or fix TMJ problems?
Well, we often get referrals from neurologists where they ruled out all kinds of other reasons for the headache, and they'd ask us to look into their TMJ and look into the way that their chewing is working, and not the other way around. A mistake would be to ignore the more common reasons for migraine and for headaches and to deal with your teeth first, which is kind of a long shot. And it's more important to first rule out all the other things. And if the neurologist had checked for all other problems and there aren't any other problems, then it pays to look at the joints because they have been connected with migraines and other types of headaches.
Right. So let me see where I get this straight. Let's just say a person has been at a chiropractor or at an acupuncture person, maybe even a podiatrist, or a physical therapist, and or maybe a neurologist or an MD, and they checked things out, and things maybe got a little better, got worse again. Basically, they're not really going away. Then it's really for sure time to go and check to see whether there is a TMJ problem, basically the problem. Can you pronounce that full word for me? Because I surely cannot pronounce it.
Temporomandibular joint.
Yeah, gee, who can say that? Would it then be time to go and look at a dentist? And my question very specifically, are orthodontists, or you for that much more specifically than orthodontists, trained to fix that if that problem is there? Or is it a general practitioner more who takes care of that?
Well, Helmut, the the efficiency of the chewing mechanism is really important because that's directly connected to the actual joints and muscles that work the jaws. So it stands to reason that if somebody's is not able to chew properly because they're missing teeth or their teeth are malaligned, that they would have to move their jaw in unusual ways in order to chew food, and that would put stress and strains on their joint. And once the joint starts to break down and have symptoms, that could be anything from locking of the jaw to pain in the jaw to headaches and neck aches and back aches. So that there's definitely a connection there. But that type of treatment has to be approached in a team approach with physical therapists and medical doctors to actually pinpoint where the problem's coming from. And often it's a combined approach to correct it.
Yeah, I've heard that sometimes, even though if the problem for sure was a misaligned mouth or teeth and joints, and that it has to be fixed by the dental field, that still, even thereafter, the chiropractor or the podiatrist is still needed, because the whole thing was misaligned for so long, so the whole bones and nerves all the way down are somehow misaligned or dense or whatever. And if you don't fix them also, then no matter what you fix here, it gets pushed out of alignment again. Is that kind of true?
Yeah, that is absolutely true. So that once damage has occurred to the joint mechanism, then the correction will not be complete until that damage is recognized and worked around.
So for purpose, you could have headaches because your feet are out of alignment, and it might have thrown off your jaws here, and you could be having had some type of back injury or misalignment which created it, or it could have started directly from here. It doesn't really matter where it started. It very soon, after a few years, affects every part, and you gotta realign and refix every part of the body. True?
Yeah, that's correct. The example that we like to use is if a person has one leg shorter than the other, then as they're walking, their spine has to compensate for it to keep themselves upright, and all the bones of the spine get worn down in a certain unusual way. Even if they then get that problem of their short leg corrected, they still have now that damage in the spinal column, and that has to be addressed as well.
Got it. And the same way, of course, with the hinges, maybe again, whatever back, neck pain or headache or hip pain came, it may come from the feet, it may come from here, it may come from a little bit of everything. Once it is advanced, you gotta fix them all one way or the other way. Beautiful. Okay?
Yeah, and Helmut, you need to understand that because that does happen occasionally where people have these problems, that we have a team in place of different professionals that see the whole picture and meet together and discuss the situation and work out what types of treatment that patient would need. It's not all treated in my office or any other particular practitioner's office.
So basically, it's not necessarily that the TMJ gets only fixed by aligning some teeth. It might also having to get fixed with a GP who grinds down a tooth a little bit, because it's just, that's the best way of fixing it, to realign it. So maybe a combination of doctors in the mouth, an orthodontist, a GP or whatever, person who is well trained in TMJ, things like that. And there might be chiropractors, podiatrists, acupuncturists, and physical therapists needed, and all that stuff.
That's correct.
Thank you very much. Very candid, very informative. Appreciate it.